Introduction to general health status and vital signs. This information will help you prepare for performing these things during your lab. So general health status and survey, what is it? This is the information you gather when you first meet your patient. A lot of it's done through observation, and it helps give you some clues to maybe the health status of the patient. It also will entail doing some vital signs, and we'll talk about those in a little bit. So the general health status survey includes the physical build of the patient, maybe their body development, their gender identity or sexual identity, their apparent age. We might compare that to their stated age, and some of those things might be surprising. Skin condition, their dress and hygiene, their posture and gait. Those things can tell you a lot about some of your patient history and what's happening with your patient. Their level of conscious, are they alert? Are they have a flat affect? Their behavior, are they relaxed? So a lot of these things we will talk more about as we go through chapter 8, but this is just kind of an introduction for your lab. So identifying facial expressions, do they have clear speech, and then identifying what their baseline or current status of their vital signs gives you a lot of information about your patient. So when we start talking about vital signs, so we'll dive right into that. You may have your temperature, maybe oral, axillary, temporal, or rectal. So this semester and going forward with adults, treating adults, we will not do rectal temperatures, and you will not perform that in the lab. But as you go into pediatrics and things like that, there may be different opportunities. So we want to help you identify. And as we go through chapter 8 in your assessment course, we'll talk more about parameters and values. But for right now, we just want you to get down what are the pieces of the vital signs and what are the instructions of how to do those. So your pulse can either be radial, or we might assess apical pulse if that pulse is irregular, your respirations, and then the blood pressure. So in the hospital setting, you would also add oxygen saturation as part of your vital signs. And but for Weber and Kelly, we will focus on these 4 things here. Your gender status vital signs equipment you'll need is the specific type thermometer you're going to use with covers, a sphygmomanometer with the gauge, blood pressure, cuff, etc., your stethoscope, and I would add some alcohol pads to clean your stethoscope, a watch with a second hand or an analog face on your watch, and just your senses of observation and your subjective data collection, talking to your patient to validate any information. So when you're doing temperature, think about the different types of temperature we talked about earlier. Obviously, for your oral temperature, that would be the most common that you'll do in the adult care setting. You're going to put the thermometer underneath the tongue, and it needs to be far enough next to the frenulum underneath the tongue. And make sure the lips are closed around the probe until it is able to, the beep is heard. Your axillary is under the arm, holding that thermometer underneath the armpit firmly until it beeps. Then temporal is taking it across the forehead. So placing the thermometer on the forehead, pressing scan, and scanning across the forehead. Then the rectal will not be done this semester, but that particular stethoscope would be placed in the rectum. So there are some variations in the expectations of temperature, and we will talk about those further in chapter 8. So let's start with look at the pulse rate, how we assess the pulse rate. So we talked about the radial pulse, and that is typically the most common when you're assessing. So your radial pulse, you're going to use the pads of your first and second fingers. You're going to lightly palpate that radial artery on the lateral aspect of the wrist. So remember, when you're talking about the lateral aspect, that we have our anatomical man. So the palms are facing forward. So laterals on the outside. You're going to count the beats for 30 seconds and then multiply that times 2. If there is some irregularity, you can count for a full minute. And that irregularity might feel like the unequal time between the beats. If there is irregularity, it is suggested that you would assess the apical pulse. So your apical pulse, you're going to need to listen with your stethoscope using the diaphragm in the mitral position on the chest, 5th intercostal space, left midclavicular line, and you will count for 1 minute, but you will auscultate. Your respirations. You're going to observe your patient, the client's chest rising and falling. So you need to, the inspiration and expiration is 1 breath. So you're going to count those for 30 seconds and multiply times 2. You want to assess for rate, but also rhythm. Is it irregular? Do they have pauses or apneic periods? And is the respiration shallow or deep? Those are descriptions that we would want to include with your respirations. The expectation is that they would be even and unlabored. So now the blood pressure. And there is a video in your Weber and Kelly about how to take your vital signs, and I've included that link on the next slide. But this walks you through this process. So you're going to use the dominant arm typically, but whenever you take a blood pressure, you are going to note on your vital signs where you took the blood pressure, which arm that you utilized. And sometimes you may have to use a leg instead. So you always want to identify where you're taking that blood pressure for consistency. You would have to make sure that arm did not have IV access, or maybe that patient's had a history of a radical mastectomy. So be sure you're aware of that patient's history, and so you're thinking things through when you're selecting an arm for a blood pressure. That can be very important. Your patient should be in a sitting position, but lying, typically in the hospital setting. You do not want to take their blood pressure when they're trying to walk around, etc. The legs should be uncrossed even if they're lying in the bed. You're going to expose the skin where you're going to put your stethoscope when you're listening in the antecubital space. You're going to try to palpate that brachial artery there, so you know exactly where to put your stethoscope. Put your blood pressure cuff on so the bladder itself is over the arterial pulsation. And most of the bladder cuffs have a little arrow that says artery, so that makes it easy to line that area up with where you palpated. The bladder of the cuff should be 80% of the circumference. So you can hold the cuff where it's just the bladder and put it around the arm and make sure that's 80%. We want to avoid too small or too large cuffs because these could cause inaccurate results. So when you use the stethoscope, make sure it's tuned to the diaphragm. And you can tell it's tuned to the diaphragm because when you tap on the larger piece of the diaphragm, when you tap on that, that sound is amplified in your stethoscope. And the biannuals, where the metal pieces are, those should be angled where the earpieces are angled towards your nose. That way they sit in your ears appropriately along your ear canal. You want to make sure when you have your blood pressure cuff, the gauge is set where you can see it, so you can watch the numbers as you are pumping it up with the bulb, etc. So you're going to take your stethoscope and hold it to that diaphragm area, and with the other hand, you have the bulb in your hand. You are then going to turn the knob valve all the way to the right to close it. Then you are going to squeeze the bulb, inflate the bladder with that bulb all the way until the beats that you're hearing disappear. Once you get to that point, you're going to deflate very slowly. And when you hear that sound start, that is your systolic number. Be thinking when you're maneuvering with the bulb and you're practicing righty-tighty, lefty-loosey. So, but you need to decrease the air in that bladder very, very slowly, about 2 millimeters of mercury per second. So you're watching the gauge as the numbers are going lower and lower. So when the final consistent beat disappears completely, that is the diastolic number. But keep decreasing the air all the way down to where it's completely gone. You're going to document what you saw to the closest 2 millimeters of mercury. The gauge is in even numbers. So you can view and watch and learn the videos in Weber and Kelly, and we will show you in the lab how to work with the blood pressure arms. Thank you and have a good day.